I'm Julie Bartke with Session Update. The expansion of medical assistance would place tens of thousands of Minnesotans on a program that receives significant federal funding. Senate author Kathy Sharon says expanding the eligibility requirements is a win-win for the state and for those who will be placed on the program. But the key debate on the Senate floor today centered on concerns that the feds won't be able to live up to their end of the financial bargain. Here are some portions of that debate.
The option is with the states as to whether or not to participate in an invitation from the federal government to accept an enhanced match to support Medicaid population up to 138% of poverty. This bill says that we're saying yes in a deliberate way to the invitation from the federal government to expand medical assistance coverage for adults without minor children up to 138% of the federal poverty guideline and accept the federal match of 100%. This enhanced match will gradually be phased down until it hits 90% by the year 2020. The adults without minor children in this population are not subject to an asset test. In addition, in this bill, the bill expands coverage for parents and children ages 19 to 20 with incomes between 100% and 138% of poverty.
There are concerns that the federal government may not be able to meet its obligations. For those of you that pay attention, the federal government now has over $16 trillion in a national debt that is increasing at the rate of roughly $1 trillion per year. Our entire economy, members, is $14 trillion. Nationally, we are in dangerous territory and in my opinion, high risk of the federal government having to renege on some of its obligations that it is promising to the states.
If there's one thing that we know is that the federal Medicaid program is broken and it needs reform, and the last thing we should do is agree to expand it before it's fixed. And so, members, I would urge you, let's not go down this path. We do not need to do that. To the extent that we need to find better ways to care for the health care of the people of this state, let's agree to do that. Let's work together to do that here, in this body, with Minnesota laws, with Minnesota programs, with Minnesota legislators working together. Let's not put ourselves into servitude to federal laws, federal rules, federal regulations that we are not going to be able to change if they don't work.
I think it's important for us to understand that those who would vote against this bill on the basis that were presented, I honor that and I respect that. I simply disagree with that is enough of a basis for us to vote against an opportunity for the state of Minnesota to bring $1 billion by 2016 into the state that we would otherwise have to pay either out of our own general fund or an increased premium costs because there will be uncompensated care for the care of a group of people that we're already caring for, simply in a very untransparent way. And to remember that a no vote on this bill gives us things. What it gives us is the loss of that $1 billion. We lose a method of covering the people up to 100% of poverty because there's nothing under the Affordable Care Act in the exchange that provides for people who are below 100% of poverty. They simply would be left out in the cold.
That legislation did pass the Senate floor.